In the year 2023, over 700 women died from preventable causes related to pregnancy and childbirth every day, with a maternal death occurring almost every 2 minutes. This is a key fact reported by WHO in 2025, and it hasn't gotten better since then, especially in low and middle income countries. Hello, and welcome to another enlightening episode of the Global Health Pharmacist Podcast. April 11 every year is International Day for Maternal Health and Rights. It emphasizes that a large percentage of maternal complications are preventable through accessible, quality care. This day is marked different from Maternal Health Awareness Day, which is celebrated on 23rd January in some countries, especially the US. So today, I'll be letting you know some key things concerning maternal health and rights. Without further ado, let's get right into it. You will agree with me that women's health should not be neglected for any reason, especially that of pregnant women. The state of health of the mother largely affects the child, the family, and the society at large. Therefore, safe motherhood is a right of every woman and not a privilege. There are 6 pillars of safe motherhood, which I'll be talking about right now. The first is family planning. This is very essential, and everyone should be aware of it, although some people frown upon it, but this shouldn't be. Every couple should plan their family in order to be able to live comfortably, especially considering the current global economic realities. No religion or ideology should forbid you from doing family planning, unless they are willing to support you financially when the children start coming. Also, there are various methods of family planning. If one doesn't agree with you, you can always try another under the guidance of your qualified healthcare professional. And mind you, family planning shouldn't be the sole responsibility of the woman. There are family planning methods for both men and women. I have an episode about that. You should listen to that to get more clarity, okay? The second pillar is this: antenatal care, which is very essential for monitoring the health of the mother and child, and especially for early detection of pregnancy complication. The third is obstetric care, which is for high-risk pregnancy to care for mothers with conditions like preeclampsia, gestational diabetes, and the likes, just to ensure that the woman is able to carry the child to term and deliver safely. The fourth is postnatal care, which includes lactation assistance, management of delivery complications also. The fifth is post-abortion care. This is for legal abortions, of course. It's for women who had miscarriages or who had to have their womb evacuated for medical reasons. They should be cared for properly by qualified healthcare professionals. This is also for abortion complications. The sixth and final one is sexually transmitted infections and HIV control. This is especially important to prevent mother-to-child transmission of HIV/AIDS and other such infections that could be transferred to the child during delivery. The 6 pillars I just talked about form rights of women and mothers in the society, and they should be upheld by both healthcare providers and members of the public. The women themselves should demand these rights. If you were not aware before, now you know. That's the essence of marking this International Day for Maternal Health and Rights. Maternal and child mortality is a major challenge to maternal and child health globally, which accounts for about 260,000 deaths every year worldwide, with the highest burden in low and middle income countries. That's about 92%, and this is preventable. Sub-Saharan Africa and Southern Asia account for around 87%, which is about 225,000 deaths out of the estimated global maternal deaths in 2023. Sub-Saharan Africa alone accounted for around 70% of these deaths, while Southern Asia accounted for about 17%. This high number of maternal deaths in some areas of the world reflects inequality in access to quality health services, and it highlights the gap between the rich and the poor. Ensuring the rights discussed earlier are upheld and maintained in various countries will significantly reduce the rising yearly maternal and child mortality globally. Well, governments in various countries have not been negligent when it comes to this right, although there is still room for improvement. Like I said earlier, and I will always say on this podcast, we all have our roles to play when it comes to public and global health. We cannot leave everything to the government, okay? I am aware of a program in my country, Nigeria, called CMONC that caters to the care of women and their babies during and after delivery. These services include 24/7 care for complications like severe bleeding, hypertension, obstructed labor, cesarean sections, blood transfusions, and specialized neonatal care. CMONC is short for Comprehensive Emergency Obstetrics and Newborn Care. So basically, all drugs, materials, and services required to care for the mother and newborn after birth complications are provided absolutely free of charge. For example, if a mother is experiencing postpartum hemorrhage after birth, which is life-threatening, she will be cared for free of charge. Presently, these services are provided through the National Health Insurance Authority, NHIA, in Nigeria, and are available in over 250 accredited government hospitals, which include primary, secondary, and tertiary healthcare facilities in Nigeria. CMONC is also available in African countries like Ethiopia and Tanzania. It is also available in Asian countries like India and Indonesia. Other countries like the US, the UK, Canada, Japan have variants called Basic Emergency Obstetrics and Newborn Care, BEMONC, which is already integrated into their healthcare services and not as separate programs. I will attach links to the websites that will show you states in Nigeria where the CMONC is operational to the description of this episode. You should check that out to take advantage of these services. As for those listening or watching from other countries, I'm sure you can get the information you need from your country's Ministry of Health website. Okay, now let's discuss how to reduce maternal mortality as well as ensure maternal health and rights from the public side. That is your own responsibility. The first is start antenatal care as soon as possible. As soon as you find out you're pregnant and your OBGYN advises you, start your antenatal care. 2, take your prenatal vitamins religiously, the likes of iron, folic acid, okay? Don't see them as unnecessary. They are routine drugs, yes, but they contribute significantly to the development of the fetus and the health of the mother. 3, be prepared for birth, either by vaginal birth or by cesarean section. If your OBGYN advises you to do CS, do not insist on vaginal birth. Also, prepare financially too. Luckily, there are programs that have been set aside to reduce financial burdens in various countries, which I've mentioned earlier, so take advantage of them. 3, only go to facilities with qualified healthcare personnel for delivery. Majority of complications after childbirth are caused by poor facilities and unqualified personnel handling child delivery. And when complications happen, they are not equipped to handle them, which leads to the death of the mother, the newborn, or both. And again, postnatal care is also very important, as I have mentioned. Support new mothers any way you can. You know, postpartum depression also occurs in some women after childbirth. Ensure that they get the care and support that they need. All right? Coincidentally, April is also C-section Awareness Month. Okay, so I would like to break some myths around CS, that is the cesarean section. You see, unlike most people believe, it is not the easy way out. It is not for lazy women. It carries significant risk, but having it performed by qualified surgeons in a well-equipped hospital reduces this risk significantly. Many women have to heal gradually after CS and are advised to avoid heavy lifting or strenuous activity in order to avoid reopening or infection of the incision site. Also, the fact that you had a child by CS doesn't mean you have to have others by CS as well. In fact, it is advised that women should try vaginal delivery after CS. You see, when you do multiple CS, adhesions could occur due to multiple incisions at the same site, and this could lead to complications for the women after doing it over time. So it is advisable that after CS, you should try vaginal birth, okay? Some of the indicators of safe motherhood are infant mortality rate, fertility rate, contraceptive prevalence rate, antenatal care coverage, percentage cesarean section, percentage of iron supplementation during pregnancy, maternal mortality rate, amongst others. So governments in each country should look at this and see how well they are doing in ensuring safe motherhood in their countries. This advocacy is not for the government alone or for the relevant agencies who are saddled with the responsibility for maternal health alone, but also for awareness for the members of the public, women and mothers in this case, to know their rights and demand them from their government and those saddled with the responsibility of administering these rights. So if you are not aware of Sea Monkey Nigeria, now you are aware. Go and take advantage of it. Go and do your research, and in other countries too, visit your Ministry of Health website to know what is obtainable, know what is available for you, and take advantage of them. Okay, and listen to the advice I've given earlier. And that's all on today's episode. Share with every woman of childbearing age you know, as well as other members of your household, because like I have always said, health is a collective responsibility. Let me know in the comments if you knew about this rights I discussed and your experiences during childbirth, if you will. Also, ask your questions about the episode. I'll be sure to reply you, okay? Do not forget to support the podcast and help it reach more people by hitting the subscribe button and clicking the notification bell so that you'll be notified whenever I post new episodes. Follow the podcast across the various social media and engage with our posts. Okay, thank you so much for listening up to this point. I'll see you in the next one. Till then, stay healthy and God bless you. Bye.